And there is, I think, unfortunately, since the last 2 weeks have happened, with all this churn on COVID vaccine guideline changes, and as a result, people just wondering about flu and RSV as well. I am wondering if we can break through the noise for all the families out there that are listening now or will listen to this later. Can you walk us through what people should be doing for COVID, flu, RSV?
And so I'll start with the easy one because there were not many changes made to this. But for influenza, for flu vaccine, the recommendation is that everyone over 6 months of age receive the flu vaccine. Also, it's important to note that if you give the flu vaccine in pregnancy, it confers some protection to the newborn. So for influenza vaccine, very straightforward. Under 6 months and older, important for everyone to get the vaccine. Last year, there were 281 deaths in children from influenza, and 90% of those kids were not vaccinated. And so it's really an important vaccine, especially for kids. I'll go to COVID next. So the recommendation that existed prior to the last meeting was really everyone who is older than 6 months of age should get a COVID vaccine. That changed a bit with an FDA approval. They added risk factors for individuals who are 6 months up to 64 years of age. And the ACIP took another step that added a barrier that's called shared clinical decision making that requires some kind of conversation with the clinician to decide whether or not to get the vaccine. It sounds good, but what it really means is that some places are requiring prescriptions for COVID-19 vaccine where before there was no requirement for such a thing. So the current recommendation is that for COVID-19, 6-month-old to 65-year-olds, if you follow the FDA guidance, would require a risk factor, and over 65, age alone is enough to get the vaccine. So it's a bit confusing because the ACIP recommendations don't correlate to the FDA approval. So the bottom line is talk to your doc about whether a COVID vaccine is appropriate. If you're over 65, it's a slam dunk. RSV, a bit more complicated. So the folks for whom it's very easy are folks over 75. That is a recommendation for a vaccine. Individuals who are 50 to 74, if they have risk factors, should also get the vaccine. The RSV vaccine also has a role in pregnancy. Now, interestingly, RSV, it doesn't cause a lot of problems in pregnant women. That's something that's really important. So when you're vaccinating at 32 to 36 weeks pregnant, it's not about protecting the mom. It's about creating antibodies that will pass to the baby at birth to protect the child for several months. If their mom does not get that vaccination in pregnancy, for newborns in their first RSV season, there is an alternative, which is a monoclonal antibody, which are antibodies from the outside that are administered that can also protect the child for several months during the RSV season.